The American Council on Science and Health, which we call ACSHA, was founded in 1978 by a group of scientists who had become concerned that the decision makers who determined public health policy in the United States were ignoring mainstream science. They started asking themselves, why aren't there more scientists speaking out to counter all the misinformation about chemicals, nutrition, the environment, and health in general? So they sent letters to 50 other scientists, asking them to join in an effort to bring the message of sound science to consumers via the media and peer-reviewed scientific publications. One of ACSHA's founding directors was Dr. Norman Borlaug, who won the Nobel Peace Prize in 1970 for being the father of the Green Revolution that saved millions of people in Mexico and South Asia from starving to death. Our president and founder, Dr. Elizabeth Whelan, a graduate of Harvard School of Public Health, has dedicated her life to educating Americans about the real health risks in life, things like smoking and obesity, not the perceived and imagined threats like trace amounts of chemicals on apples or in plastic containers. She's my personal hero for taking on the misguided activists who scare us needlessly and for always standing her ground in defense of sound science. Our mission has remained the same since our founding, to promote sound science in regulation and public policy, to assist consumers in distinguishing real health threats from purely hypothetical ones. We believe there is too much focus on things that people don't need to be worried about. Smoking and obesity are two real health risks, but too many activists and policymakers and demagogues are more concerned with trying to ban technologies and products that have been proven safe for decades, like BPA, a chemical used in the lining of food cans that actually protects food quality and keeps people from getting sick from contaminated food. Instead of focusing on trivial or really non-existent health risks, we need to make people more aware of true health risks. The number one public health threat is cigarette smoking. If there's one thing that would save more lives than any other measure, it would be to reduce the deadly toll of smoking-related diseases, which is predicted to take the lives of 1 billion people in this century. Like so many nonprofit groups, we need more resources. We're a small group doing yeoman's work. With a larger budget, we could take on more issues and add more staff that would allow us to be even more effective in getting our message out. ACSHA is the only independent consumer health education and advocacy organization in the country that promotes sound science and is also backed by a scientific advisory board. Since our founding in 1978, ACSHA's advisory board has grown from about 50 to nearly 400 scientists, physicians, and also public health policy experts. Our advisory panel experts represent all kinds of fields: agricultural biotechnology, chemical and pharmaceutical sciences, pesticides, nutrition, children's health, environmental and public health, and toxicology, just to name a few. All of our scientific publications are peer-reviewed, just like the major medical journals. And we don't let anyone outside the organization have any editorial control over the findings in our studies. We go where the science takes us. Our adherence to the science makes us effective. Even when someone disagrees with our findings, no one has ever been able to successfully challenge us on the science. Unlike the activist groups, we do our research before we stick our necks out on an issue. Everything is peer-reviewed. We have an excellent research staff with the backgrounds and knowledge that give them the needed credibility to speak authoritatively on a scientific topic. ACSHA has also entered the social media arena with followers on Twitter as well as a dedicated Facebook page. In addition, over 8,000 readers, including acclaimed journalists, receive our daily e-newsletter, Dispatch, which includes insightful commentary on the latest health and science news. Our website gets over 150,000 views daily and up to 30,000 unique visits each month. Our critics refer to us as an industry-funded group. It's true, we do receive some support from companies that produce safe and beneficial products. But that's only a small part of our funding base. We're not only funded by industry, we have a diverse support base consisting of thousands of individuals and private family foundations, as well as corporations and trade associations. ACTIA defends the rights of the American consumer to continue to have access to the safest and most enviable food supply in the world, and to enjoy the highest standard of living with the most innovative and beneficial products developed in the world. Every day we come into the office ready to counter the junk science that is used to attack the technologies that make our lives longer, healthier, easier, and more enjoyable. ACTIA was among the first organizations in the U.S. to formally endorse tobacco harm reduction, alternative nicotine products that don't have the deadly side effects that come from inhaling tobacco smoke. We spend a lot of time educating public health authorities on how many lives could be saved by encouraging smokers who haven't been able to quit to instead use something far less risky to their health. The addiction to nicotine is incredibly hard to break. We're also strong advocates for reducing deaths in Africa from malaria. One of the most hated and feared chemicals in modern history is DDT, but it's been wrongly vilified. More than 50 million African lives have been lost, mostly women and young children, because of the misguided ban on DDT, which has the potential to save hundreds of thousands of lives annually. Our writings have called attention to this needless tragedy, and we believe we have played some role in the increasing use of DDT in sub-Saharan Africa, an accomplishment of which we are quite proud. In 1999, we fought against the anti-chemical hysteria engendered by activist groups against the common and long-used chemicals called phthalates, DEHP and DINP, which make PVC vinyl flexible. A vigorous activist campaign pressured healthcare institutions to eliminate DEHP, the substance which allowed blood bags and IV tubes to be flexible. We convened a 17-member expert blue ribbon panel to evaluate these phthalates and render an opinion. Their report exonerated the chemicals as a cause for human illness. We have reason to believe that this report, published in the peer-reviewed journal Medscape, with an accompanying live press conference, stemmed the anti-phthalate hysteria for a decade. We've also recently researched and published a report showing how chemical pesticides are hugely beneficial, causing no health effects in humans from the foods we eat. We discussed this publication on Capitol Hill twice, educating staffers from Congress, the USDA, and the EPA. For the first couple of years, ACTIA didn't accept support from trade associations or corporations, but the media still regularly implied that ACTIA had industry support because our message was so counter to the gloom and doom scenarios that the activist groups were promoting. ACTIA's board of directors concluded that what critics objected to was not ACTIA's funding, but our views, that we were limiting our fundraising potential by avoiding corporate support. So the board voted to accept donations from corporations, as long as there are no strings attached. This remains our fundraising policy today, with our support also coming from thousands of individuals and private family foundations. The important thing is not the source of our funding, but the accuracy of our work. And ACTIA's scientific advisors and use of peer review keeps us credible. We're proud of what we've been able to accomplish with the limited resources we have, compared to groups that promote junk science, health scares, and hype. Some of those groups have budgets in the tens of millions or hundreds of millions of dollars, significantly dwarfing our tiny annual budget. With additional resources, we'd be able to reach more consumers, opinion leaders, and policymakers, and we would also expand our traditional media and social media outreach. We're constantly exploring the use of various media and other venues that would allow us to more widely disseminate our organization's important publications and public health information. ACTIA already has a significant Twitter following, but we'd like to continue to expand that. In the past, we've held press conferences and sponsored symposia that include renowned researchers and medical professionals. We'd like to continue to host such events. We've also organized academic presentations, including the European Sciences Open Forum in Turin and at the American Academy for the Advancement of Science Conclave in Vancouver. We are eager to do even more such educational outreach programs.